So in this day and age, there is so much information available. And we all know that information is power. But what I've been looking at is all the research. So what are women over the age of 55 actually looking at? And one of the things I discovered was that they're actually looking at health research and advocating for their own well-being. And I just think this is super, super awesome. So gone are the days where we would simply go to a health practitioner and we wouldn't question anything and we wouldn't ask and we wouldn't go into details. What we're actually doing now is we're going in, we're armed with research, we're asking questions, we have a clear understanding of what's going on with our body, because it is our body. And it's not that we're challenging the medical professionals. What we're doing is we're trying to partner with the healthcare providers so that we get an optimal outcome for ourselves. I think this is fabulous, don't you?
Mm-hmm.
Yeah.
So very important.
Very important. So here's what it showed, is that what we're looking at is age-specific health conditions, medication management, and preventative care and wellness. So if I start with age-specific health conditions, you only have to think about, so, when we started working in this field like 20 years ago, nobody was talking about menopause. Now everybody's talking about menopause, right? And so therefore it means that younger women, like I only have to look at my daughters or daughter-in-laws, they're all going, oh, I think I'm in perimenopause. I think I've got hormonal changes happening, because we're talking about it and they're actually researching it, which is fantastic.
Which is good. Yeah.
Yeah, absolutely. So we're looking at hormonal changes and treatment options. We're also looking at bone health and osteoporosis prevention. We're looking at heart health when it comes to cardiovascular risks, because we know that we are at risk, greater risk as we're aging. We're also looking at sleep disturbance and some solutions for that, because we know that menopause is hell on wheels when it comes to sleeping, right?
Yeah.
And I know this is something, are you finding you're sleeping any better these days, or not so much?
Not so much, no.
No, okay. And it's like you're walking around every day like the Walking Dead, basically.
Mm.
You feel like that, don't you?
Yeah, there's been a few days where I'll be talking to the kids and I'm being deliberate with my words and slowing down because you forget what you're saying.
Yeah. Oh, yeah, because you haven't had the sleep and you just, it's just not happening.
What were we talking about? Yeah, so I make sure I'm very deliberate when I slow down and talk to them.
Okay, so when it comes to management of medications, what we're doing is we're looking at what that medication is. So we're finding out about that. We're looking for side effects. We're looking at alternate treatments. And we're always keen on what the latest medical research is and any breakthrough treatments in regards to, whatever that happens to be for us. I think that's fabulous. I mean, all of these things are great things. And then when it comes to preventative care and wellness, we are looking at nutrition and exercise that is appropriate to our age. We're looking at mental health and stress management, which is a really interesting one. We're looking at the regular screening that we need to do and what the recommendations are. And sometimes I don't think those recommendations are enough. So this is where tuning into your body and understanding your body is a great idea, because I know that the outcomes for me in my 40s would have been very different had I have not been insistent on that there was something wrong with me. Mm-hmm. We're also looking for those alternate or complementary therapies. So I think all of this matters because we're making informed decisions about our own care. We're equipping ourselves to be able to better communicate to healthcare providers. Like I remember as a kid, Sal, the doctor had asked me what was wrong and I'd go, I don't know. Would you do that?
My daughter is 20 and I have to go to the doctors with her. And when he asks her what's wrong with her, she looks at me.
Yeah. She needs to listen to this episode.
Yes, she does.
Yeah.
And I'm looking at her and I'm going, you know, while I can tell him that you've got a sore throat, you need to give him more information.
Yeah, that's right. That's right. Exactly. Okay. And I've already alluded to this earlier. We're more likely to detect, you know, potential health issues. And the other thing is that we become a valuable resource to our family and friends, don't we? Because we are learning it.
Yeah.
So I think that's where that ripple effect comes in, because we all know if we've got a spouse, they tend not to actually seek out medical help. So because we're doing it, we're all more able to help them. We're also able to help those adult children, which is what you're talking about, because, you know, they start to have health issues of their own as well too. We're also able to help those grandchildren with healthy habits. And we're also able to help those friends of ours with any health concerns because we're learning more. We're being more open-minded as well too. So I think as this trend grows, and, you know, fingers crossed it does, that we recognise that women are prepared to educate themselves in regards to health, that we're just not Googling, we're actually looking for reliable, age-appropriate health information. And I think that, you know, our health professionals need to embrace that we're coming informed into our consultations. And we're creating a space where women can actually share knowledge and experiences with themselves as well too.
And I think that's probably one of the most important ones, that we are talking amongst ourselves and we are talking with the younger generations. You know, my mum's generation, for example, your mum's generation, it was very hush-hush.
Yeah, you didn't talk about anything
like
that.
You know, like she did. My mum didn't talk to us about her going through menopause, I think, until, you know, I would have been in my late 20s.
No, I remember. Yeah,
so it was very hush-hush. The other one was, you know, when she was going through HRT, going through menopause, HRT was such a bad thing.
Oh, bad thing. Yeah.
Bad thing. But with our generation and, the generations below us, we're sharing our information. You know, I've had so many women come up to me and they ask me questions. You know, that's me as a trainer as well and a PT. They come and ask me questions, but, you know, we're always sharing information and sharing knowledge. Oh, you know, I saw this article or I saw this article. I heard about this fabulous doctor down at, you know, Springfield. And So I think that's so important that we are doing that.
Oh, absolutely. Absolutely. And I think it's really important to just say, like, we're not suggesting that we're replacing the medical expertise. But what we're doing is we're going, I'm going to be an active participant in my health journey.
Yeah.
And we are coming with the knowledge. And with that knowledge, we've got power.
Yeah. And we're not just going to one spot, you know, Google, Dr. Google, just to get our information. You know, we're looking at research papers, we're looking at health articles, we're looking at we're listening to podcasts.
And there are absolutely fabulous doctors now who, you know, they're just, and researchers who are bringing their knowledge and to us in a more easy to understand manner.
Yeah.
So that we can go, oh, wow, that was amazing. And, you know, one of the, just recently, Dr. Vonda Wright and Gabrielle Lyon did a podcast together. And, you know, every woman our age should be listening to that. You know, I shared it within our communities. It's like, this is important stuff. We need to embrace these things that they're talking about, because it's not just airy fairy. It's real. You know, the walk doesn't do it for you. It's not going to keep you strong.
No.
And I think Vonda was the one who said it's just like the icing on the cake. You know, it's the topping. It's not the be all and end all, you know, nor is Pilates or yoga. They're fabulous add-ons. Here's the base stuff that we need to be doing.
Yeah.
And we know that that's strength training. We know that we need to push our heart rate. We know that we need to do balance work. We know we need to jump, all of those things. So I think that this is fabulous that we are now starting to talk about it, that we are accepting responsibility for us. And we're not just simply going to the doctors and they say, here's your prescription, off you go. We're not doing that. We're going, well, what ifs? And we're asking the questions.
Perfect.
All right. So thanks for joining me, Sal.
Thank you for having me, as always.
You're very welcome. Thanks for joining us, ladies. Hope you got something out of today. I just want to say that this information that I've shared today is from digital behaviour from early 2024 that I had looked at. So that it's not just something that I've made up. It is something that is out there for everybody to see as well too. All right. Take care. See you all soon. Bye for now.
Bye, guys. Bye.
Bye.